understanding the same. Last time also we have shared certain aspects, but today I will going to share with cases and different types of varieties of cases in today's session. So it is always better to start with these two words, the sick, the first chapter from Kant's philosophy and first aphorism. Hahnemann have used this terminology, and that's why it has a big meaning. So there are n number of approaches to understand the sick, as there are n number of personalities, and this is so. There are varieties of personalities and varieties of approaches, because every time it is something different. Because human is not only the material, not only limited, but it is beyond limit, because it has a dynamic aspect also. And that's why few things we're going to share in today's session. So I want to share my aspect of perceiving the case, that is understanding the case. I don't want to teach you to follow what prescription I have given to the patient. Prescription is not important, but I want to share the process of logic I used to understand the case. Once you learn the logic, everything is there in the book. So logic you have to learn, logic you have to understand. And whenever you are learning with anyone, always make an habit that you learn basically the logic behind that. Whatever may be the prescription, you go on learning that logic. So we'll start with the today's session, and whenever we have to learn anything, we have to go to our Bible, we have to go our big important subject, and that is the organ of medicine. Because whatever is there is the result of experimentation, for 53 years of experimentation, which is contributed by Hahnemann in the 6th edition of Organ of Medicine. And that's why we'll start with the session with few things from the organon and how they are practically applied in our day-to-day practice. First important thing when dealing with the sick, you have to go to the first important aphorism, that is aphorism number 83, where Hahnemann have mentioned what are the qualities of the homeopathic physician in order to deal with the patient. And these are 4 important highlighted qualities are there. The first is freedom from prejudice. The second is sound senses. The third is attention in observing. And fourth is fidelity in tracing the picture of the disease. Yes, we have learned the organon. I don't want to go into the organon, but I want to collect something which is essential and which we have to apply when we deal with the cases. Very difficult thing is the freedom from prejudice, because we always get prejudiced because we have intellect, we have memory, we have logic, and everything is saturated in that memory, and that's why it comes every time against in front of our mind when we deal with another patient. So to come out of that prejudices is very difficult, but one has to achieve. Second, whenever you are dealing with the cases, you have to go on observing what is there, what is something which is important for you to reach to the simile. So second important is sound senses. Even the patient is waiting in the waiting room, your senses should be alert enough. You can catch the way he coughs and you can listen that and you can apply that, because if you are alert enough, then that is also important thing. Third one is attention in observing. Whenever you are dealing with the patient, you go on observing, and there are a number of things which give the clues, which gives the symbols. Yes, this is what I require. This is the rubric of the whole situation. This is what I expect. This is the patient is telling you. Only thing is that you must have that perceiving eyes, and that's why attention in observing. And lastly, what he says is the fidelity in tracing the picture of the disease. Yes, this is too important. Fidelity means exactness. Whatever the patient is saying, every sentence has a meaning. The sentences should not be changed, because they come right from the mouth of the person, they are right from the brain of the person, they are the individualistic. And that's why every sentence uttered by the patient has a meaning. It has a different aspect. And that's why today we are going to learn certain things, certain qualities, how to apply it in practice. 2 more aphorisms I will going to highlight. One aphorism is aphorism number 211, where Hahnemann says that this holds good to such an extent that the state of disposition of the patient often chiefly determines the selection of the homeopathic remedy, as being decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. I have highlighted the word state of disposition of the patient. There is little bit controversy in the people's mind. Hahnemann have utilized the word state of disposition and state of mind, two different entities. People take it is only the mind. No, it is not only the mind. It is something more than that, and that's why it is not only just a thing which is there, and that's why what do you understand by disposition of the patient? Some people considers in Marathi it is swabhav. It is not only swabhav. It is something more than that. And if you open the Tabor's dictionary, you can find it out the meaning of the word. What is disposition? Disposition says a natural tendency exhibited by an individual or group of individuals. This may be manifested towards acquiring certain disease, presumably due to the hereditary factors. So these are the things which are hidden, which are lurking behind in the form of a miasms when we think homeopathically. It is not only just a mind, because Hahnemann have utilized both the words in one aphorism. He has utilized the state of mind and disposition. When we open the 220 aphorism, we can find it out. He has added two words by adding to this the state of disposition, state of the mind and disposition accurately observed with patients. So these are two different terminologies. You have to deal with the material aspects, you have to deal with the dynamic aspects, and both are necessary when you deal with the patient. So you have to consider both the things at a time. You should not just look towards the superficial aspects, how the patient has entered, you have seen the certain things and you have prescribed. No. What is the need of the patient? What is the state of his disposition? What exactly the problem he is suffering from? What type of disease he is having? How much depth depth of that disease is there? That is there in the state of disposition, and that is very important for us when we deal with the pathology. And that's why I want to teach you in today's session. I will not share too much cases. I will going to share with you only 4 cases. But every case you will going to learn something.